Assalamualaikum my viewers, welcome to Social Garage. Today we will discuss about heart failure. Heart failure is a complex progressive disorder in which the heart is unable to pump sufficient blood to meet the needs of the body. Its cardinal symptoms are dyspnea, fatigue and fluid retention. So basically, dyspnea is shortness of breath, or you can say it's an intense tightening in the chest, feeling of suffocation or difficulty in breathing. Okay, next fatigue. Fatigue is basically tiredness, constant tiredness or weakness. ठीक है. Fluid retention is known as edema, or the fluid is not removed from the tissues, so we can say it is fluid retention. Okay, now underlying causes of heart failure include arteriosclerotic heart disease, myocardial infarction, hypertensive heart diseases, valvular heart disease, dilated cardiomyopathy and congenital heart disease. Role of physiologic compensatory mechanism in the progression of heart failure. Chronic activation of the sympathetic nervous system and the renin-angiotensin-aldosterone system is associated with remodeling of cardiac tissue, loss of myocytes, hypertrophy. Now, goals of pharmacologic intervention in heart failure. Basically, goals of treatment are to alleviate symptoms, slow disease progression and improve survival. So accordingly, 7 classes of drugs have been shown to be effective. Number 1, ACE inhibitor. Number 2, ARBs. Number 3, aldosterone antagonists. Number 4, beta blockers. Number 5, diuretics. Number 6, direct vaso and vasodilators, and number 7, inotropic agent. Depending on the severity of heart failure and individual patient factors, one or more of these classes of drugs are administered. Pharmacologic intervention provide the following benefits in heart failure: reduce myocardial workload, decrease extracellular fluid volume, improve cardiac contractility, and a reduced rate of cardiac remodeling. Therapeutic strategies in heart failure. Chronic heart failure is typically managed by fluid limitation. क्या limitation है? Less than 1.5 to 2 liter daily. Okay. Low dietary intake of sodium is very necessary. Okay, now third, inotropic agents are reserved for acute heart failure sign and symptoms in mostly the inpatient. Inhibitors of the renin-angiotensin-aldosterone system. Heart failure leads to activation of the renin-angiotensin-aldosterone system via 2 mechanisms. Number 1, increased renin release by juxtaglomerular cells in renal afferent arterioles due to diminished renal perfusion pressure produced by the failing heart, and second, renin release by juxtaglomerular cells promoted by sympathetic stimulation and activation of beta receptors. The production of angiotensin II, a potent vasoconstrictor, and the subsequent stimulation of aldosterone release that causes salt and water retention led to increases in both preload and afterload that are characteristic of the failing heart. ओके, उसके अलावा क्या है, भी कैटेगरीज हैं, एस इनहिबिटर्स हैं जो हम प्रीवियस स्लाइड में देख चुके हैं. इसके अलावा एंजियोटेंसिन रिसेप्टर ब्लॉकर्स हैं, ये भी हम ऑलरेडी रीड कर चुके हैं. इसके अलावा एल्डोस्टेरोन एंटागोनिस्ट. Patients with advanced heart disease have elevated levels of aldosterone due to angiotensin II stimulation and reduced hepatic clearance of the hormone. Spironolactone is a direct antagonist of aldosterone, thereby preventing salt retention, myocardial hypertrophy, and hypokalemia. Eplerenone is a competitive antagonist of aldosterone and mineralocorticoid. Now, beta blockers improve systolic functioning and reverse cardiac remodeling in heart failure patients have been observed for beta blocker. These agents decrease heart rate and inhibit the release of renin in the kidneys. In addition, beta blockers prevent the deleterious effect of norepinephrine on the cardiac muscle fiber, decreasing remodeling, hypertrophy, and cell death. 3. Beta blockers have shown benefit in heart failure. Bisoprolol, carvedilol, and long-acting metoprolol succinate. Diuretics relieve pulmonary congestion and peripheral edema. This decreases cardiac workload and oxygen demand. Diuretics may also decrease afterload by reducing plasma volume, thereby decreasing blood pressure. Loop diuretics are the most commonly used diuretics in heart failure. Now, vaso and venodilators. Dilation of venous blood vessels leads to a decrease in cardiac preload by increasing venous capacitance. Nitrates are commonly used venous dilators to reduce preload for patients with chronic heart failure. Arterial dilators such as hydralazine reduce systemic arteriolar resistance and decrease afterload. If the patient is intolerant of ACE inhibitors or beta blockers, or if additional vasodilator response is required, a combination of hydralazine and isosorbide dinitrate may be used. A fixed dose combination of these agents have been shown to improve symptoms and survival in Black patients with heart failure or on standard heart failure treatment, beta blocker plus ACE inhibitor or ARB. Headache, hypotension, and tachycardia are common adverse effects with this combination. Inotropic drugs. Positive inotropic agents enhance cardiac contractility and thus increase cardiac output. Although these drugs act by different mechanisms, the inotropic action is the result of an increased cytoplasmic calcium concentration that enhances the contractility of cardiac muscle. Number 8. Digitalis glycosides. The cardiac glycosides are often called digitalis or digital glycoside because most of the drugs come from the digitalis foxglove plant. They are a group of chemically similar compounds that can increase the contractility of the heart muscle and therefore are used in treating heart failure. The digital glycosides have a low therapeutic index with only a small difference between a therapeutic dose and doses that are toxic or even fatal. Therapeutic uses KSK. Basically, it is indicated in patients with severe heart failure or EF after initiation of ACE inhibitor, beta blocker, and diuretic therapy. A low serum drug concentration of digoxin 0.5 to 0.8 nanogram per ml is beneficial. Now the question arises here, what is HFrEF? Okay, so basically heart failure with reduced ejection fraction is HFrEF happens when the left side of your heart doesn't pump blood out to the body as well as normal. It's sometimes called systolic heart failure. This is because your left ventricle doesn't squeeze forcefully enough during systole, which is the phase of your heartbeat when your heart pumps blood. Now, this is the mechanism of digitalis glycoside. They inhibit sodium potassium ATPase pump. Glycoside binds with potassium binding site of the enzyme. So, decrease in resting membrane potential, increase excitability, arrhythmia, extrasystole. Decrease sodium potassium pump, increase intracellular sodium, inhibit sodium calcium exchange, increase intracellular calcium. Potassium flows out of the cell, slowing of AV conduction, bradycardia, heart block. Interaction of actin and myosin, increase cardiac contractility, decrease heart size. Now, inotropic drugs. Toxicity, cardiac effects. Severe bradycardia, paroxysmal or non-paroxysmal arterial tachycardia, AV block due to ventricular ectopic, premature beat, ventricular tachycardia और fibrillation. इसके अलावा नॉन कार्डिक इफेक्ट्स हैं एनोरेक्सिया, नोजिया, वॉमिटिंग, विजुअल डिस्टर्बेंस, वेरी रेयरली डिलीरियम और कन्वर्जन. फीचर्स ऑफ डिजिटलिस पॉइजनिंग, हमारे पास जीआईटी प्रॉब्लम्स हैं, सीवियस प्रॉब्लम्स हैं, सीएनएस प्रॉब्लम्स हैं. मैनेजमेंट ऑफ डिजिटलिस पॉइजनिंग और टॉक्सिसिटी में क्या है कि स्टॉप और करेक्ट द डोज, करेक्ट इलेक्ट्रोलाइट abnormally, that is hyperkalemia, use drug like atropine, administer digitalis antibody to prevent arrhythmia, lidocaine or phenytoin can be given to insert temporary pacemaker. Nowadays digitalis antibody digipine is used IV. Now adverse effects. At low serum drug concentration, digoxin is fairly well tolerated. It has a very narrow therapeutic index, and digoxin toxicity is one of the most common adverse drug reaction leading to hospitalization. इसके हमारे पास साइड इफ़ेक्ट्स हैं एनोरेक्सिया, नोजिया एंड वॉमिटिंग. These are the indicators of toxicity. Patient may also experience blurred vision, yellowish vision, xanthopsia and various cardiac arrhythmias. Toxicity can often be managed by discontinuing digoxin. Severe toxicity result in ventricular tachycardia, may require administration of antiarrhythmic drugs and the use of antibodies to digoxin, digoxin immune fab, which bind and inactivate the drug. ठीक है, ये बेसिकली एंटीडोट है डिजॉक्सिन का. Digoxin should also be used with caution with other drugs that slow AV conduction such as beta blockers, verapamil and diltiazem. Beta adrenergic agonists such as dobutamine and improve cardiac performance by causing positive inotropic effect and vasodilation. Phosphodiesterase inhibitors हैं जिसमें हमारे पास आते हैं मिलिरिनॉन. Milrinone inhibits phosphodiesterase enzyme. Experts have classified heart failure into 4 stages from least severe to most severe, जिसमें हमारे पास है stage A, stage B and stage C. In stage 1, cardiac disease but no symptoms and no limitation in ordinary physical activity. In stage 2, mild symptoms and slight limitation during ordinary activity. Stage 3, significant limitation in activity due to symptoms, comfortable only at rest. Stage 4, severe limitation symptoms even while at rest. So here I am ending my lecture. Hope you will like it. Please like, comment and share, and don't forget to subscribe my channel. Allah Hafiz.